All right, tell us a story about what happened to this hand here.
Okay, the dogs began fighting, and I tried to pick one up and separate them, and the other latched on, and she wouldn't let go. She weighs about 12 pounds.
Mm-hmm. And this was last night, you said?
Yes, last night about 5 p.m.
Okay. And you can see obviously the 2 puncture wounds right there and there. And the swelling wasn't there last night when you went to bed?
The swelling was, but it was just in the little finger.
Like the bruising stuff here. Mm-hmm. And then develop into this. Go ahead and flip the hand over. And you can even see the redness here. Particular kind of pattern. And then of course on the other side again, it's got the lymphangitis. It means that some people call this blood poisoning. It's not poison. It just means infection in your bloodstream. Now, it's not like other people call infection in your bloodstream sepsis. You're not septic. Although you have a source of infection, you don't have fevers and chills and other things like that. You do have a white count elevation of 18,000, which is definitely a systemic response. And then this is what we call the lymphangitis. As far as our concerns are, because these are puncture wounds, that those, like we were discussing, the animals, those dogs have very thin teeth, so the first thing is to make sure that one of them didn't break inside. The X-ray was negative, so we know it's not there. Secondly, because of where it's at, you worry about it puncturing through into the tendon sheath, and then therefore that's a very soft space that if bacteria get in there, they can grow very quickly. And that's when it becomes more of a surgical treatment of the disease versus just medical treatment, which would be antibiotics. With dog bites and cat bites, you want to use augmentin. That's amoxicillin with clavulanic. And if you're allergic, then you can use clindamycin, vancomycin, and other things like that. We were planning on giving you a dose of IV antibiotics and then sending you home with follow-up with orthopedics, but after discussing with the orthopedic, he said that the better thing to do for you is to give you the IV antibiotics and keep you in the hospital so we can watch it more closely. Obviously, kind of like mark this so we know where it's at now and we can track it if it's getting worse, if it's getting better. Obviously, this kind of pictures will help to define if it's getting worse or not as the hours progress. Did she already give you the shot for pain?
She did.
Okay, because I was going to change it IV now that I know you're staying, but she already did. Okay, any questions?
No, thank you.
All right.